Hello. So hello. Good morning, good afternoon, good evening. Thank you so much for joining us today in this live case from our center. So we have a very interesting case. We have a cystic lesion in the head of the pancreas, and the evaluation of this macrocystic lesion is very important to have a diagnosis because regarding the etiology or the histopathology of the lesion, it's very important to take a decision. What kind of decision? It means we need to send this patient to surgery, we need to just follow up, and this is very important because we can avoid the development of potential malignant lesion in some cases. So when we are in front of this lesion, so we need to do an evaluation with B mode using US. As we are looking here, so we have a macrocystic lesion, but when I turn a little bit, I see that this cystic lesion have a septum here first. So what do you see more? We see a little bit of cloudy areas here. And the third thing that I need to evaluate during my B mode is if this patient or this lesion have communication with the main pancreatic duct. And what I see is that probably yes, because I see my main pancreatic duct here. You see here, and there is a connection here. So regarding this characteristic, this help us to have potential diagnosis. In this case, we already know that mucinous cystic lesions can have this kind of characteristic. However, there is other kind of lesion like serous cystoadenoma or other lesions that can be confused. Moreover, if we have macrocystic lesions. So, so what is the next step? So if you have technology, you can have access, and the best way to evaluate this kind of lesion is to use confocal laser endomicroscopy. It means we can evaluate the epithelial tissue in real time and to have a diagnosis of this lesion. However, if we see some kind in our practice in this institution, if we see if there is a mucinous cyst lesion or potential malignant lesion, we will do and take a biopsy using Murray biopsy forceps or through the needle biopsy forceps. So we will start our evaluation using confocal first, and regarding the characteristic of the lesion, we will take a decision what is the next step to have best diagnosis of this lesion. So I am inside the lesion. You can see here my needle. Okay, so I will push my confocal. Confocal is going out. It's there, so we need to use fluorescein injection. And now we are looking. Now we're looking very well. I am trying to change the position of the needle a little bit. So you can see here. So you have confocal in your screen now. What I see is epithelium here. I am not looking. I am not seeing any vascularity as we can see or so during serous lesion. So we see this kind of epithelium here and this wave like like we already published in GI endoscopy, a multicenter study with the characteristic of the lesion. So this appears to be a mucinous lesion, very clear. There is not, you see here this wave, this is epithelium here. So it's very clear that we have a mucinous cystic lesion. So so in this case, I believe it's much better to have a histological evaluation for the surgeons. First, because this patient have a risk of malignancy, and second, because of I will go out. Sí, espera, no, un segundo. And second, because of there is a communication with the main pancreatic duct, so probably this patient needs complete resection of this lesion, and it's in the head of the pancreas. So potential treatments in case of contraindication for surgery are the use of injection therapy using paclitaxel and alcohol, and at the same time we can use also radiofrequency or microwave ablation for the future, but we need to see what should be the results in prospective studies and protocols inside. So for the moment I will do some biopsies from the lesion, and then I will do an aspiration, because it's very important to do an aspiration also of the liquid. All the tissue or examination that you can have is will increase the results of your diagnosis. So now I use preloaded my Murray biopsy forceps because it's easier to pass than stay with the needle inside. So now I am inside. You see? Abre. Cierra. No. Abre. Cierra. No. Abre. Cierra. Okay, now I have tissue. And I will do an aspiration now. Abre. Yeah, we have tissue here. Okay. I will do an aspiration, I will finish. Okay, thank you so much to stay today. Just continue to follow us. We will see you in a few days with more cases. Cortamos la transmisión, gracias.